California is closing down again.
Effective today, requiring all counties to close their indoor activities. Restaurants, wineries, tasting rooms, movie theaters, family entertainment centers, zoos and museums, card rooms, and the shuttering of all bars.
For counties like Los Angeles on the governor's watch list of the worst, there's even more shuttering.
Fitness centers, places of worship, offices for non-critical sectors, personal care services, that includes hair salons, barbershops, and indoor malls.
Meanwhile, Florida is smashing records. More than 15,000 new COVID cases Sunday, the most logged in any state, any day, ever.
We have to get control of these numbers. These numbers are out of control.
Disney World just opened 2 parks, but if you don't wear a mask, you won't get the photo from your ride. Seriously, that's part of the enforcement.
We can turn this thing around in 2 to 3 weeks if we can get a critical mass of people wearing face coverings.
But there's no federal mandate. Meanwhile, in Texas, the average daily death toll just doubled in a week. Harvard researchers say these 8 states should also roll back reopening.
You don't necessarily need to shut down again, but pull back a bit.
Dr. Fauci says in large part because
people in some states who went from shutdown to complete throwing caution to the wind.
Atlanta already rolled back to phase 1. The mayor and her family recovering.
We are a textbook example of how quickly this virus spreads. We had one child in the house who was asymptomatic. I was also asymptomatic, and my husband doesn't have any underlying health conditions, and this has hit him really hard.
Internal CDC documents uncovered by the New York Times suggest fully opening K through 12 schools and colleges would be the highest risk option. And that's what the Trump administration wants.
It is a political roll of the dice for us. We are the dice, the teachers in the classrooms.
Los Angeles, second largest district in the nation, just said school will start back in August, online only. There is a way out of all this. New York City opened slowly, mandated masks, and just reported no deaths from COVID-19 in a day. 0. Now, worldwide, Wolf, we have just passed 13 million COVID-19 cases. Nearly a quarter of them are here in the United States, in this country where we have the biggest economy on earth, plenty of money, many great minds, but we are doing something, or many things, very, very wrong. Wolf?
I think it's fair to say there's been a major failure in all of this, given the numbers that we're seeing right now. Nick Watt, thank you very much. Now let's bring in 2 leading medical experts. Dr. Vivek Murthy is the former U.S. Surgeon General, and Dr. Peter Hotez is a professor and dean at the Baylor College of Medicine. Dr. Murthy, California now taking a very big step backward, shutting down all indoor activity statewide. You're in Florida right now. You're down in Miami, which just set the record for the highest number of new cases reported in a single day by any state so far over these past 5 months or so. Do other hotspots, do you believe, Dr. Murthy, need to follow California's example right now?
Well, thank you, Wolf. It's good to be with you tonight. The measures that California took to pull back on indoor gatherings, and these are exactly the right measures. They need to be taken in many places. What we have seen and learned over the last several months with this pandemic is that half measures do not work. And unless we do everything we can now, we are only going to prolong this pandemic and prolong the loss of lives and the suffering that we've already sustained. What that means is that states that are experiencing major outbreaks, which include Florida and Texas and Arizona, parts of California, South Carolina, these states need to, 1, require that masks be used in public, and 2, they need to pull back on allowing bars and restaurants and other indoor activity to take place, because this is what we know facilitates the spread of the virus. The truth is, even if we did that, that would just buy us time. And the question that we have to ask ourselves is, how do we use that time to prepare once we start to relax restrictions, once caseloads come down? That means that we've got to really invest in expanding testing, in contact tracing capacity. This is the same playbook that we knew we had to execute in the earlier part of the year, in March and April. But as a country, we failed to do that. And so we have another opportunity to do that. But it's going to require us getting the caseloads down. It's not going to be easy, but it's what we have to do at this moment.
You know, it's interesting, Dr. Hotez. Dr. Fauci says, and I'm quoting him now, we don't necessarily need to shut down again. But he also says we haven't even begun to see the end of it yet. What's your perspective from Houston? That's another hot spot right now.
Well, you know, if you look, Wolf, at the trend and the line going up, it's still accelerating rapidly. We were at 40,000 cases a couple of weeks ago, 50,000 new cases per day. Now we're at 60,000 cases. That number is still climbing. So there is no end in sight. This doesn't go away by itself, Wolf. This requires intervention, and it's going to require a federal plan. These are, I know people use the word hotspots. These are not hotspots. This is a massive resurgence of our COVID-19 epidemic sweeping across the southern half of the United States. We're out of control right now. And until there's this federal plan that lays out a strategy for all of the states and looks at what we have to do to get close to containment mode, we'll continue along this terrible path. It's not even conceivable that we could open schools right now in most of these southern states, because the minute we do that, teachers are going to start to get sick, bus drivers will start to get sick, school cafeteria workers will start to get sick, and it'll happen within a couple of weeks. And then the whole thing shuts down again anyway. So there is no plan. There is not even an attempt to really be frank with the American people about the problem. We heard with the press conference today, there was no admission that this was a huge public health threat to the American people. There were attempts to obfuscate the deaths and other things. We're not even in the position to admit that there's an issue.
Yeah, I look at the numbers of Americans, not necessarily just confirmed cases or hospitalizations, but deaths. Hundreds of Americans are dying every single day, and that's been going on and on with no end in sight right now. Dr. Murthy, the White House press secretary, called the U.S. response to this pandemic historic, saying the United States is beating the rest of the world on key metrics, including testing. Give us your reaction when you hear a boast, a claim like that.
Well, Wolf, I would respectfully disagree with that assessment. I think that our response strategy as a country has been frankly embarrassing. We have the capacity, the knowledge, the resources to mount the kind of response that a pandemic like this merits, and instead we're behaving like a failed state. We're not communicating truthfully with the public. We're not executing in a manner that we can and that the American people deserve. We said months and months ago that we would provide and build a capacity for adequate testing in this country, that we would provide the contact tracers needed to help contain infections. We didn't do that. And we're now, unlike many other countries, which were able to get levels of virus down, we're suffering through another resurgence. And because of that, we are not able to open schools. Because we failed to execute properly, we are not able to open up our economy. One of the hallmarks of pandemic leadership is that you have to step up and fill the gaps. You have to take responsibility for actions, and you also got to make sure that you are getting resources to people on the front lines. It's not too late to turn this around, but without better leadership, we are in for a long, long struggle with the coronavirus.
And many thousands more Americans are going to be dead as a result of what's going on right now. Dr. Murthy, thank you. Dr. Hotez, thanks to you as well.